The idea of the Asian Pacific Liver Center is a medical center that can reach out to the Asian community where language and cultural issues are not a barrier.
The Asian Pacific Liver Center at St. Vincent's Medical Center is a great example of a partnership between physicians who are committed to excellent patient care and an organization such as St. Vincent's that has such a rich history in community outreach and community services.
You know, chronic hepatitis B affects about 400 million lives worldwide, and about 75% of those patients are in those countries in Asian Pacific Island.
The Liver Center was actually a concept of Dr. Sailing Fong and Dr. Ho Bei's, who approached the hospital recognizing the hospital's history and community service, seeing if we could create a model that would help support patients who are at risk for hepatitis B and provide them comprehensive care.
Hepatitis B is called the silent danger illness among Asians because for the vast majority of individuals with chronic hepatitis B, they have no symptoms. They can go on for years without manifesting any signs of chronic liver disease. And it's only when the disease is at the very advanced stage that they might manifest signs and symptoms of liver failure. And very often when the symptoms manifest, the disease is so advanced that liver transplant is the only option available to these individuals.
The overall prevalence of hepatitis B in Asian Pacific Islander community will be about up to 10%. It varies from different ethnic background. Korean Americans are well known to have about 7 to 8% of prevalence. In Chinese American communities, it tends to be higher, up to 10 to 15%.
We know that hepatitis B has significant incidence within the Asian Pacific Islander community, and I think what we hope to demonstrate with the Asian Pacific Liver Center is that by doing extensive education, outreach, and screening with those individuals that we know are at high risk and catching them before they have significant progression of disease, we can prevent catastrophic types of illnesses which would obviously have a financial impact.
We have organized health fairs where we have offered free screening to check for hepatitis B.
We've been going out to churches since the launch of Asian Pacific Liver Center in mid-November 2007.
I think this is must be our 7th screening this year. And so far, I think we've screened a little over 1,000 people for hepatitis B and C. When somebody comes in to be screened, they fill out our registration packet. They hand it to us. We have our computer database system where we input their information into our computer and we print out labels that will go on the test tube as well as a form that goes to the lab. We call the participant up and have them go to the phlebotomist table to have their blood drawn.
The screening process requires just one tube of blood. The test is hepatitis B surface antigen, a very cheap and simple test that can be run at almost any lab, but it has to be ordered specifically because it is not part of a routine blood panel that an individual might get as part of their routine history and physical exam.
I've learned how to train and recruit volunteers who have just as much passion and enthusiasm for this kind of work as I do. On any particular screening event, anywhere between 10 and 15 volunteers, including the phlebotomists who are drawing the blood. It's a pretty amazing collective effort.
Once we found the positive patients, we start calling them and start consultation right there. We encourage them to come into the Asian Pacific Liver Center for physical exam. We do have nurse practitioners here who speaks Mandarin and Korean, and we will take full history, including family history, because it is very important whether other family member has hepatitis B. Then Dr. Fong or Dr. Bei will be seeing patient for consultation.
I think going through a screening process is a win-win situation. If the patients get diagnosed with hepatitis B, then that means that they are finding out about their infection with hepatitis B virus at early stage, and we can monitor them closely and offer treatment to minimize complications. If they do not have a hepatitis B infection, if they are at risk, we can offer vaccination and prevent them from getting infected with hepatitis B virus.
It is far more cost-effective to treat and manage patients early than to be investing in the management of patients with advanced liver disease who is so sick and will be in and out of a hospital. And there's another point that I want to bring up, which perhaps isn't shown in the dollars and cents. As a liver specialist, one of the reasons why I am so passionate about the Asian Pacific Liver Center is for the past 10 years I have been a liver transplant hepatologist. So I'm a physician that takes care of patients in need of a liver transplant or who have had a liver transplant. And I cannot tell you how gut-wrenching it is to take care of a patient with advanced liver disease, to tell them that their liver disease is so far gone or that their liver cancer is so far gone, and not even a liver transplant is an option for them. And I'm always reminded that every patient is not a statistic. Every patient is either a son, a daughter, a husband or a wife, a brother or a sister, a grandfather or a grandmother, and a friend to so many people. And every patient we lose to hepatitis B affects many, many more people than that one individual. And that is the big reason why I am so passionate about the Asian Pacific Liver Center.